Hello everyone, I'm your host from Research Update Organization and you are watching the video series of clinical research education. You can join our Facebook group and you can subscribe our YouTube channel for the latest update. Also you can join our Telegram app, which is Q&A Research Interest Group. We will start our session soon. Last time we covered introduction, the type of the research, and I'm going to quickly go through that. We cover observational studies, interventional studies, and review studies. These are the major three types of the research, and usually you will be taking care whenever you are actively into the research field. You will be taking care most of the time observational studies. If you are like faculty member or something, then you will be dealing with interventional study as well. But if you are not in that academic or you do not have the sophisticated research system, then you will have uh, mm, it's a less experience of research, but in that case you will still have a chance, or you will still have opportunity to review article type of studies. And in the review article, as I mentioned, systematic review, meta-analysis is something consider having equal value like original article. Okay. Today's session will be keeping on introduction to writing manuscript. It's not going to be the manuscript, but it's more or less on focusing on the different type of research article. Okay. So we are going to go quickly through what are the types of original research article and what are the type of non-original research article. So some people have questioned that even though I'm not in academic original research, can I do the original research or not? So we are going to show you basically how many different type of original non-original article exists, so that you can have more knowledge about how and what type of article your research deserve. Let's start with the full-length original investigation or full-length article, full-length manuscript. Usually full-length manuscripts, we'll see the characteristics for each soon, but usually the full-length original article or investigation is a kind of observational studies or interventional studies which require a particular database, and then you run the thing, you prepare the manuscript and you submit. When the word count is like more than 3,500 or around 3,500, then we prepare the proper table work, figure work, and then we submit into the manuscript form in a journal, which we call it full length article. I'm going to quickly also cover a few of the example of full length article too. So let's see. Let me start with a few example of full length article, and let me share my screen. Okay. So full length article is usually having, let's say we are having here one of the full length article, usually having a structured abstract. In structured abstract, you will have, we will talk about more about introduction session, what is structured abstract and how it look like. Usually it's having introduction part, the abstract itself is having introduction part, it's having method part, it's having result section, it's having discussion section, not discussion but kind of a line or two line of conclusion section, and then you will have a full length of introduction. We will talk about more in detail that introduction, how you will write introduction, how many paragraph you should consider, what should be the strong introduction. But there will be a detailed introduction of comparison of previously published study, the gap in the current knowledge, and what is going to be the aim of your study. Then you will have, in full length article, you have a method section where you will be covering the characteristic of the data. We'll cover everything in detail later on, but I'm just quickly going through so you will have idea. So you will be having a method section which contain the data of your hospital or whatever data you are studying, the whatever cohort you will be studying. Then you will have the characteristic of the studies population. Let's say if you are taking African American, Hispanic, or Asian, then in particular headache disorder or anywhere, you will choose those sample size. Then you have to mention that what will be my study population and how it should look like. Then hospital characteristics and patient characteristic, you will be also going for outcome measurement. In outcome measurement, you will write primary, secondary outcome in detail with definition. You will write detail of analysis part, and then result section will come out, including detailed result. And then you will write after detail section. The links are there, material will be there, so you can have a look in detail once you are having chance. But when I talk about full length, it will be having all this detail, including discussion and limitation section of the study and conclusion. So I hope you are having idea about how full length research article look like. We will read the criteria for full length, but it is overall full length article will look like. But let's say this is a original study, but sometime even people publish epidemiological study in full length article. Let's say, let me go through that. So if the disease is rare and the information is not available very well, then you can even choose a study population's characteristic, and you can publish as a full length article, original full length article, which is called observational study too. So here the epidemiology of COVID, the authors have published, and in which they just definitely, it's having background, it's having method, it's having in abstract, it's having result, it's having conclusion. But then you will see that they put the case report even to make it little more interesting. But in the method you will see only particular one sample size of hospital where they just see the characteristic. There is no other detail on your primary, secondary endpoint. Those are endpoints are not clear. Just it's epidemiological characteristics, demographic and clinical characteristics of the patient, right? So we are not defining here outcome. We are not doing univariable, multivariable, complex analysis. We are just telling everything in a percentage, pool percentage form. It's going to be descriptive study, but it is still a powerful study. So that is something also considered as a full length article of another type. So usually we'll talk about more of survey studies. That's also original research, but and you can prepare into the full length article too. But I'm just talking about right now observational studies, which consider as full length. Now some of the people don't have time to write this detailed studies. They still wish to publish their finding. Now they have another section called brief research. It's called original research, but it is considered as brief research, where you will be submitting your detailed finding in only 1200 words, only 1200 words. So that brief research could be anything from original article. So it could be observational studies. I think they have taken it down, but let me check. Hold on. It could be original study, that's completely fine, but the result should be mentioned in very brief. Very brief means I'll cover that in this section. Probably the request is not available, so it's going to be very brief. So what does it mean by brief? They only let you include only 3 figure and a table, including total number will be 3, or sometime it's like even less than that. So it's very focused, not detailed method. They wish to know everything in focused way. If you have time and you still wish to submit your secondary finding, you can submit every finding in supplementary material, means additional material. The reason why, because let's say a good journal published 12 issues every month, one issue. Some very good journal publish every 15 days issue. They do not have much space. They do not have much space to cover original articles like in that intensity. So they always consider 2-3 original article in every volume, or maybe 5, but then brief article, rest of the article will be in brief form. So brief article, if you think your findings are good, but it is not that important to describe in detail, then also the brief article is the option. The third original same research, you can present your work in a form of research letter. It's a very small 600 words of study, exactly same study which you will be using in 3000 4000 word, but in this case you will be having it in a form of extremely small manner. So here it's a research letter related to the COVID. Another one, respiratory parameters in the patients with COVID after using non-invasive ventilation in the prone position outside ICU. So probably the JAMA is having a lot of paperwork coming, and they might not have that much of space to cover everything. So you can see their manuscript will be exactly similar, looking like a longer abstract. Usual abstract is 250 to 350 word, but this will be a detailed abstract, but it's going to be exactly same looking like that. So you can see there is no abstract. It's a small introduction, and even method is also 2 paragraph, and their method is finished. And their result section is again 1 paragraph, and whatever they wish, they cover everything in one one table and one figure. And then discussion is exactly same like a conclusion of 2 line of the abstract with the limitation. So this data, whatever limitation is having, if they are mentioning, that itself is sufficient. So this is also a type of original research. But you can see that if you are resident or fellow or early career faculty where you have less time, then see there is another option. You can still publish, and all 3 have equal value. Those all are citable, will show everywhere in PubMed, Google Scholar. People have questioned, then everything they will be treated as equally. But only the thing is that depend on your availability, timing, the journals resources, and your capacity. You convert your research into 3 major original research article form. Okay, now that is the observational study we were talking about, but there are a few more original research article which we would like to quickly cover, and that is very interesting. Probably some people have research experience, so they might know the previous information, but this information will be something new, I hope. So let's say some journal also accept systematic review as original article, but systematic review and meta-analysis or meta-regression is for sure quick publication and original article where you do not require ethical permission, IRB permission, or anything. You can do it in your country even though you do not have IRB or ethics committee there. So it's solely depend on your skill and your level of judgment. So systematic review and or meta-analysis, meta-regression. Another type is again systematic review, but the survey studies. So these are considered as equal weightage of original research article, but the fundamental paper writing style will be different. That we will cover it later on, but I'm just going to quickly show you the example and how they usually write it, so you will have idea about this type of article too. So this is one of the studies. It's pure systematic review, but as Nikhila told me that how you can make your literature review more interesting, then this is the way you can make your literature review more interesting. So these people did mortality and morbidity trend after first year of in first year of survivor of MI, a systematic review. So the difference between systematic review and literature review, as I mentioned in the last class, a systematic name suggests you systematically go through the databases like Embase, like PubMed, Medline. Here is the information on the in method section. You will have a detailed section on that, but this type of databases you will be searching with some inclusion exclusion criteria, and you are going to prepare the table work, and then you will be writing the part. But this is a kind of literature review, but they try to conduct in a way of systematic literature review, so that acceptability will be more the authentic or more easily acceptable, right? So it is going to be, if it is systematic, that means it requires the structured abstract. We'll talk about structured abstract, but here it's a background, method, result, conclusion. Again, in the background section, they write a small detailed paragraph about what they want to do, what will be their aims and objective. We'll talk about how to write the methods in the detail for systematic review, literature review, systematic review and original studies. But this is method section of systematic review. So though they have systematic review search, and then they put this figure that from 21,000 article how they reach to the 13 article. Don't be panic, you're not going to read that 21,000 article, right? Ultimately you are going to study in detail 13 article, and kind of superficially, but yes, you require a little bit of resources, like human resources. You need 2 3 4 researchers to read the abstract and get the data out of 130. But basically you will be collecting data from this 13 article in detail. So ultimately when you are going to write literature review, you are going to write out of 13 only 3 4 5 6 article, but here you will get more article basically, and you collected the data and the present in a proper way. Like, what was the study characteristic? Let me make it bigger. What was the study characteristic? Yeah. So they wrote it in a form of where, which country the study occur, what type of data, year, resources and references. So this thing is like a type of characteristic, and then their secondary outcome was mortality. So they basically indirectly, without making sure that the result is there, you just have to identify the result and you just have to write it here. And in discussion section you will be discussing this table work. So when you're discussing table work, it's easy to write, and it will not look like you're writing a story. Otherwise you will, in literature review, you will never realize that when you sidetrack yourself and writing important but something else which you did not aim about. Okay, so that is a very important part. So here they make sure from 1311 article have mortality present, so they just kind of phrase the mortality definition or mortality numbers and everything detail. The similarly after mortality, relative risk analysis, they did it for same all cause death. So they divide into the man and woman, but the thing is that everything is already there. They just collect it in a proper way so they can um, explain themselves betterly, but in a form of paragraph. Here they also collected data on cardiovascular outcome. So if you're writing literature review, you will write everything haphazard and messy, but here you can see that the way they have collected: incidence another paragraph, relative risk another paragraph, risk factor another paragraph, cardiovascular outcome, incidence, relative risk, those are different paragraph and discussion. So this make your same literature review more powerful and give more validity to literature review, so it's going to have good acceptability. So this is how you can just write systematic review, but it will be then considered as for most of the paper original research. Then one more type of article, just hold on. Okay, so this article is systematic review and meta-analysis. Systematic review and meta-analysis. Now, what is the difference between just systematic review and meta-analysis? I'll not go through all in detail, but I'm just uh, picking up the table and chart. So exactly same thing. They have divided the undiagnosed myocardial infarction patient diagnosed by ECG and MR. What MR? Let me just read the exact name of the test. It's called MRI, or I'm going to check, but it's a two diagnostic method. I think it's MRI only, magnetic resonance imaging. Yeah, cardiac magnetic resonance imaging. Yes. Okay. But here, what you will see here in table 2, they collected the data from each and every study. The study number 1 suggests that one device, here it's mentioned that by if you are going through X method, then myocardial infarction unrecognized versus non-detection, or recognized versus non-detection. So they basically collected the data. They collected the data with one hazard ratio, second hazard ratio, third hazard ratio, and they use the sophisticated software like say comprehensive meta-analysis software or review manager software, and then they counted the final total pooled prevalence and pooled hazard ratio. Or pooled means that, let's say, one study occur in one country, another study occur in second country. Both studies are having different type of setting, variation in their study, different type of sample size. So one says that there is 0.88 hazard ratio, right? So X is better than Y, or X is having higher side effect than Y, but hazard is 0.88, so it's not significant. We'll talk about more in statistic how you can see that. But one says 0.88 and another says 2.90. Now whom to trust, whom not to trust, right? So in that case, after 5 studies come out or 4 studies come out, people do meta-analysis of those 4 studies, interventional studies or observational studies. We should use the protocol like Prisma protocol, Moose protocol, various type of protocol, international stroke guideline you are going to use. We'll cover that guideline later on, but those protocol you are going to use it, and you are going to find out the pooled detail of that, and you will be writing your result in that form. So here they have considered another all cause mortality, cardiovascular mortality, everything they calculated. So this is the difference between meta-analysis and systematic review. So when you are going to do analysis, any type of analysis using review manager or some software, you are mentioning it in your result section. I'm quickly coming to the result section. So here in the result section, you will see that they have calculated, and they did not write anything like theoretically or like whatever in a descriptive form. What they wrote it, how many number of total studies they evaluated, how many patient came, and from that what is the hazard ratio they find out. So these studies are difficult to it's a little bit skill work. It's a little difficult to do analysis part and evaluate, but it's very easy to write, because like other study, you don't have to write description in detail. You are just going to write a quick short result, mixture of everything. Okay, so that is the difference between systematic review and systematic review with meta-analysis. Okay, I'm going to now go to the third different type of the study. So this is the second study which you have seen. Now this study which we are going to see, one second, let me load it. Okay, so this is also called meta-analysis, not meta-analysis, the systematic review and analysis. But this analysis is a kind of cases. Some people says that is it good to publish a case report when you are having one case report? It's extremely rare that your case report is not having similar case report on internet. So similarly, one of the, this is the case report of nummular headache. Okay, so let's say if someone is having a very interesting case like something kind of nummular headache, though it is not rare, but it is rare, then rather than publishing as a case report, even though you can add as a case report on top and then you can start your study, but you can write that, but you should try to look on PubMed or another search engine similar many case report, and you will definitely get 15, 20, 30 cases, right? So those 30 cases, if you are collecting systematically, you can write that you did systematic search on PubMed and you collected your data. The same data, either you can, of the cases, you can write it in a form of a systematic review with your case and systematic review, or if the data, if you are lucky and you are getting more data, then in that case you can even perform the analysis, because it's a case reports, so you can't perform Prisma protocol or something like that. But still they have, if it's observational study, they have Moose protocol. You can follow basically a system. It's a list of protocol we'll go through, but you can follow a systematic protocol, and you can even do a small type of analysis. Like here they perform chi-square test or percentage, they calculated relative risk ratio. So that's how you can do that. But you can see, let me show you the very important thing. So if you are having time, and if you think it's the same going to be methodology with search strategy and everything, but what I want to show you is that here what people are doing is, sometimes they keep it they keep the data open. Okay, so here, so probably one is your own case report, but if you will search, you will find many cases of that similar case on internet. And if you are if you are like a beginner, then you have more time, then you can collect those cases, like what that study is having, how many number of cases, what will be the age, gender, age group, latency of pain, VRS, duration, everything you can count. The data collection will try to cover it in a later section, but you can cover this all data, make your own data. You do not require these all are de-identified data from internet, right? You are just collecting them and writing in your Excel sheet. So now you are having your own data. Now if you wish to publish one manuscript, two manuscript, you are having opportunity here. So you can analyze this data and see how many, what is the prevalence of male and female, then how many, what will be the diameter of the pain, quality of the pain. You here people did little complicated work, that different studies, because it's a rare case. Some people have tried sumatriptan, tricyclic, antidepressant, lamotrigine, gabapentin, carbamazepine, some, and after that some people also tried surgeries and then Botox injection. They tried many things. So the study division occur in basis of temporary resolution versus no sorry, total resolution, yes and no, and temporary resolution occur and none. And then let's get back to the study. So you will have idea. So this is a simple case, but how you can present your simple case in a complicated form, that is something important. I'm going to show you the table. Just give me 1 second. So okay, so then you can put one table of study characteristic, what was the age and sex of the patient, and then you can write the characteristics, clinical characteristics of the patient, like what was the age group, and adult and pediatric, and gender detail, mean, median, mode, onset of pain, latency of the latency from the first attack. So all the clinical characteristics, these characteristics do not require biostatistic work. It's just the percentage work. Okay, and anyone can do that. And then you describe that following the table. And then to make that little bit more complicated, we divided that population to resolution occur, resolution not occur, and then again p-value. Here the software SPSS or SAS will be utilized to get the p-values basically. So you write the p-value of the characteristic of the patient in the cases means resolution did not occur, and control means resolution occur, and then you find out characteristic, and then also figure out different response rate of different medicine. So this was a simple case report, and this is having a completely different phase after reviewing properly. So moral of the story is, even if you are having a good case, that does not mean that's the only case in the world probably. So you will be getting at least 10 cases on PubMed. And I believe from my experience, 90% cases are not in a real category of case reports. They all are very common, not very common like in a prevalence form, but at least if we consider 1% prevalence of any disease is there, and you show up that finding in your hospital, that means it must exist somewhere else too in the world. That means you have more data. Why can't you collect those data and even try to put in a table form that these are my case reports or case series, but still we have 10 more cases from PubMed, and we are comparing our cases, our management with those cases, right? So that could be a good comparative study. Okay, one more another type. So this is just give me 1 second. Okay, if we are going to get, okay, so this link we already click. I wish to show you one example of survey too, but let's see, we'll try to cover that. Okay, so survey studies are also the kind of studies nowadays. In COVID, many survey studies came out, how people are responding to COVID-19, let's say survey study. Now my concern is that in survey studies, most important part, how you are, sorry for the advertisement, it's not intentional, because we are directly dealing from one system to the Google, that's why they are throwing the advertisement. So usually in these survey studies, you have to be a little bit careful of choosing questionnaires, choosing the platform. Though in survey, it's not mandatory that you must be situated in particular part of the world and you need some permission, you can still prepare the survey. Survey is like a very simple, could be asking your patient, are you satisfied from our treatment or not? That is also simple survey. From there you can choose a very complicated survey, that whether this telemedicine network is operating well or not in your system, what is the satisfactory rate, what is the show up rate, what is the quality and improvement, what type of complications are occurring after that thing, what are the limitations. The survey, you can make it as easy as possible, 1 2 3 question survey, and you can make it as complicated as possible. So it's up to you how, on what type of survey you wish to choose. So survey is basically very simple. You created the questionnaires, you prepare the email, and you email the targeted population or contact them in your clinic, in your hospital. If you're a medical student, you can even check the survey. You can check the students burnout in your batch, in your senior batch, junior batch. So basically this survey can be on online. Usually nowadays e-surveys are famous. You can have it on paper-based survey too. Those survey you can collect according to the methodology, and after collecting that, the finding you analyze in a way. Let's not go to the finding, but let me tell you how you can represent the surveys usually. So this is a very easy survey, but the good thing about this survey was like it is still giving you very solid information in US when the people of US, it is open in public. So 5,000 people responded here in the survey. We have taken their education level and everything, and the authors of the study have evaluated the role of various type of information system, whether they are getting information from news or social media or whatever. So actually from healthcare professional, only 37% of education people are perceiving. From WHO or CDC, those type of organization, 43% of education is perceived, and 71% to 50% is through social media. So you can see that how probably misinformation on social media can increase the severity of any information or any disease. So similarly, so when the people were asked to see that what will you do to avoid contamination, the wearing face mask, because social distancing is good but it's not permanent. For example, I'm talking about for COVID, right? So wearing face mask is one of the surest way until we are not having vaccination thing. Washing the hand and everything is good, but people here believe, this 5,000 people at least believe, out of that 58% people are telling that we believe in wearing face masks. So it shows that even some probably this percentage are higher, but my concern is that you can see how can the simplest survey can evaluate the perception of people, perception of student, perception of healthcare provider. So this is the perception of one disease. There could be different type of survey you can choose, right? The question will be maybe severe, or question maybe a little bit of less severe. People in this crucial time, rather than focusing on learning some good skill, more people are watching television and Netflix. So this type of thing you can prepare and you can present. It will not take much time on survey, but I'm just going to end up the survey thing here. But the survey is another sophisticated way to present your work or to start your work. Now, I was talking about a different type, and we were talking that what will be the differentiating cutoff, whether it should be the brief article or original full-length article, or let's say it's a meta-analysis, whatever. So every journal has a section called instruction to authors. For some of them, it's some of you people are having, it's very easy to I mean, you know this part, but I'm quickly going to cover. Every journal has their criteria. You just have to make sure after finishing study, kind of have a look on description, whatever journal you are targeting. But usual requirements are here: 3,000 article, 3,000 word in the original investigation with 5 tables, compared to we are not talking about clinical trial, compared to brief report 1,200 word, 15 references, structure abstract, and they wrote it right, follow equator guideline. So you have to follow either Prisma guideline, Moose guideline, which are all are the part of equator guideline. Even for case report, people publish case report without any guideline. It's a guideline called care guideline. So the guideline is a kind of, we'll cover those guideline, but guideline is a kind of thing, what to cover must. So it's a mandatory covering of the part. So every journal has their instruction. I encourage you to go and read that section while you are doing studies or after you finish the study. Now, someone asked me how literature review can be publishable and what is the best approach in literature review. We are having one of the very good example of literature review. It's a recommended strategies for the identifying the burnout and recognizing, identifying, and managing the burnout. Now, we will focus here. When you are there is basically two point before that. It's a non-structured abstract. It's just like a storytelling abstract. Similarly, after introduction, After introduction, we are directly having discussion. After introduction, we are having directly discussion. No method section, no result section. After discussion, we have conclusion. But now, if you are writing here simple writing everything without subsection, then there will be no meaning. It's very boring. People will not like to read. Even reviewer will not like to read. So that's why two key point I wish to discuss. Number one, table work, and number two, depend on table subsection. Create, I highly encourage you to create subsection in the discussion and address the discussion according to the subsection. So here this authors have divided that discussion of burnout in the form of acknowledgement. One section, they are acknowledging the crisis with the evidence of all the studies. Then they put the factors contributing the burnout. Factors they divided into global strategies, what are the current strategies which is creating the burnout, national issues. Then from global and national, they jump to the national policies, which is not that easy and friendly. Then work environment and hospital policies, they're the local policies. And then work life balance issue, the personal life issue, I can say that, how it is affecting. Now one more thing, now impact of the, then another subsection, the third subsection was the impact on the personal life of the physician, on patient's life, on healthcare expenses and burden. So another one is the resources available currently to identify various type of technique to identify. But can you see that every section finish, it's having a table. So if someone is not interested in reading the long description, then they can still read your table work, that factor number one, compromising patient care by making error by physician. This is ramification. So what will happen if burnout increase, and you put the supporting studies, second study, third study. So whatever studies you are getting it. Similarly, strategies to identify, you write strategy, that's okay, but it's good to write in a table form too, in a very short way. Probably you write the strategy, advantage, disadvantage, number one, number two, number three. So if someone is not interesting to read the whole detail, uh, then still they are having table work to follow. And then they also write different strategies at different level. What strategies you can use it at hospital level or global level or something. And then they recommend the strategies, that which are the methods and recommended strategies you can adapt at individual level, at training level. So if you are in a program, academic program, at administrative or hospital level, at national level, and at the global level. So I believe this is a very solid form, and then you write your strategies in a very brief way. So I believe that could be the easiest way and understandable and effective way to present your literature review. Okay. And then there are some more type of article will quickly cover, but those are the expert article for the people who are in their field working since many years. They usually write letter to the editor, or I can say correspondence. Research later was different, which we talk about. Research later is different than later to editor. Letter to editor is some study published. Let's say this is a very famous point investigator clinical trial, the role of clopidogrel and aspirin in stroke and TIA patient. So many people, once original article published, many people write correspondence. You can see here correspondence and editorial in a very brief way. Sometimes it's invited, sometimes it's non-invited, but you write it that in your study you did XYZ. In this study, the authors of that study did XYZ, and these are the limitation of the author, these are non-limitation of the author. So basically you are mentioning the problem, or acknowledging or supporting that study. That is not original research. Okay. And that could or may not come on PubMed or Google Scholar. Maybe it's gonna come because it will be having DOI, but correspondence and those things we don't keep it in a original section. Okay, sometime let's say, let me tell you, some people also publish the viewpoint. The viewpoint are hold on, viewpoint are the points uh, hold on. The important findings, what some of the expert have evaluated in their hospital. They just write the later form. I'll put this presentation there. I will upload all this links, so probably you can copy and paste the link, and then you can see it from there. So in some of the article you will see that in our hospital we have seen this, and we try to do this to mitigate the burden. These are the simply viewpoint, but viewpoint is also not a good form or a real form of original research. That is concluding the various type of research, original and non-original article will look like, and how you can create a platform basically while you are doing your research, that what type of journal I would like to choose, what type of article I would like to convert and before I publish. So these all are the detail about that type, the section. Next section will be covering the manuscript structure. I can say the basic fundamental structure or anatomy of the manuscript. I will go through this thing in detail, that how you will write the cover page, what will be the problem in these all sections, and how you can compare different studies using this structure. And you have to make sure that you have to comply the guideline of the journal, because what happen if your research is strong but your cover page like a personal statement is not strong, it's not going to be having that good weightage. If your title page is wrong, they will send you 10 times back that, add this, add this, add that. So not only doing research is important, but also having information of correct system of submission, how you should prepare those documents and how you should submit. That is also important, that we are going to cover in the next session. Now I'm going to take the question very quickly. So if you people are having any question, either you can raise the hand or type in the chat box. I'm going to try to cover one by one.